Small businesses are struggling to understand how a key element of the Affordable Care Act affects their business. Emily Maltby joins us to tell us about that. Thanks for coming in, Emily.
Thank you.
So, we're talking about a health care tax credit, yes?
Yes.
Describe it for us.
For small businesses, if you offer health insurance to your employees, since 2010, you've been eligible to take this tax credit, which is supposed to help make the cost more affordable. The cost of health insurance is a very big problem for small businesses. And we don't actually have last year's numbers, but we do have 2010's numbers. That was the first year that it rolled out. And keep in mind that millions of small businesses were supposed to be eligible for this tax credit. And a report from the government came out that said that only 170,000 actually took it in that first year. So we've been taking some looks at why those numbers are so low. And
it's not just because taxes are complicated and people don't know. It's more. It sounds like from this survey work that you've done. And here's the poll. We're going to throw it on screen here. The healthcare tax credits poll of small businesses. This, of course, is from the Wall Street Journal and Vistage International. But I guess, tell us on screen what we're looking at here. Effectively, people just don't know that they
That's a big
qualify.
problem. That's exactly right. So one of the findings of this survey that we released yesterday found that a survey of about 1,000 small business owners, the majority of them, 2/3 of them, actually did not even know it existed.
How much could they be saving? How much could they be saving here?
Well, it's about 35% of what you're offering, but you have to fit into a very specific criteria. You have to be only the very smallest of businesses to get that full 35%, and then it starts to go down as your business gets larger. So it's really targeting very small businesses with low-paying, low-wage employees. So if you are a professional firm and you have high-salaried workers, you're probably not going to get it, or at least the full amount. And so I think there's sort of a disconnect here because a lot of those very, very small businesses, they might not know about it, but they also probably don't offer insurance to their employees anyway. And that's something also that we've been trying to uncover is exactly how many of these really small businesses that could potentially qualify for the full amount of this tax credit actually offer health insurance, because you have to offer it in order to get the tax credit.
Is this, by the way, at risk of being struck down today?
Yeah. What we're going to be looking for is parts of the bill that could be overturned, and if the whole law is struck down, this would go with
Naturally.
it.
I guess I wonder if it's not, would this be one of the provisions that is particularly controversial that might go?
I don't believe so.
Yeah.
I don't believe so. I think what we'd be looking for is more of that sort of sweeping strike down of the law, and in that case, we would see more of these business owners saying, well, okay, you know, of the percent that did actually get the credit, now what?
But yeah, and even if it is upheld, there is going to be some debate about expanding this
That's
provision.
exactly right. So the question is, since a very small number of business owners actually took the credit, there's been debate over whether they should keep it really targeted at those very, very small businesses, or whether they should expand those parameters that are making it so limited and say, okay, maybe larger employers can take it too, or maybe employers with higher wage employees can take it too. And what we saw actually in the 2013 budget from the Obama administration was a proposal to do just that. However, there are critics that say the tax credits don't work. They don't really incentivize businesses to take on something that they simply don't want in their business. Many business owners probably think, you know, regardless of whatever the tax credit is, health insurance is just simply too expensive, and it's not worth the hassle in many cases.
Just as a final point, for the small business owners at home, what are the basic criteria, just quickly, so if they want to go back and ask their tax advisor whether they qualify?
Right. So if you want to qualify for the full credit, you have to have fewer than 10 employees. To qualify for any part of the credit, you have to have fewer than 25 employees.
And of course, offer a healthcare plan.
And you have to offer a healthcare
Yeah.
plan. You also have to pay for at least 50% of the premiums.